Which of the following antibiotics is potentially ototoxic and may cause irreversible hearing loss? A. Gentamicin. B. Penicillin. C. Doxycycline. D. Erythromycin. The answer is A. Gentamicin. Gentamicin is an aminoglycoside antibiotic. Most antibiotics in the aminoglycoside class can have significant ototoxic effects. Of these, streptomycin and gentamicin are primarily toxic to the vestibular system, while amikacin, neomycin, dihydrostreptomycin, and kanamycin primarily affect the cochlea. None of the other antibiotics listed are generally associated with ototoxicity. A 24-year-old female presents with a simple urinary tract infection, for which she is prescribed ciprofloxacin. What is the most severe potential side effect of this medication? A. Tendon injury or rupture, especially Achilles tendon. B. Kidney failure. C. Hepatotoxicity. D. Seizures. The answer is A. Tendon injury or rupture, especially Achilles tendon. Ciprofloxacin has been associated with several cases of tendon injury and rupture, with the typical rupture occurring in the Achilles tendon. Other less severe side effects can include nausea and vomiting, headache, insomnia, and increased sensitivity to caffeine. The other symptoms listed are not generally associated with ciprofloxacin use. Which of the following antibiotics is strictly contraindicated in pregnancy, in lactating mothers, or in children under 8 years old, due to risk of irreversible teeth staining? A. Tetracycline. B. Ceftazidime. C. Rifaximin. D. Clindamycin. The answer is A. Tetracycline. Tetracycline antibiotics are strictly contraindicated in pregnancy, in lactating mothers, or in children under 8 years old, due to risk of irreversible teeth staining. The discoloration occurs only in adult teeth that have not broken the gum line, so adults are not at risk. A 42-year-old man with a history of severe depression who is currently prescribed multiple antidepressants presents with tachycardia, hyperreflexia, sweating, mydriasis, myoclonus. He is confused and mildly agitated. On questioning, he admits that he may have taken one too many of one or more of his medications. What is the most likely cause of his symptoms? A. Hypertensive crisis. B. Serotonin syndrome. C. Extrapyramidal side effects. D. Tardive dyskinesia. The answer is B. Serotonin syndrome. The symptoms this patient are presenting with are consistent with serotonin syndrome, a rapid onset and potentially life-threatening condition of excess circulating serotonin. Symptoms can range from mild to severe, and may include tachycardia, nausea and vomiting, diarrhea, hyperreflexia, sweating, mydriasis, myoclonus, mental status changes, headache, and coma. Serotonin syndrome is generally caused by drug interaction or overdose of drugs that raise circulating serotonin levels, such as selective serotonin reuptake inhibitors, SSRIs, and monoamine oxidase inhibitors, MAOIs. A 63-year-old female presents with involuntary grimacing, lip smacking, excessive blinking, and sticking out of the tongue. She also flicks her fingers and her wrists. She states that she has no control over these movements, and that they have gotten progressively worse over the last 3 years. Her family is worried that she may be experiencing an early form of dementia. Her medical history is significant for depression, for which she has been taking aripiprazole for the last 9 years. Which of the following is the most likely cause of her symptoms? A. Early onset Alzheimer's disease. B. Worsening depression. C. Tardive dyskinesia. D. Serotonin syndrome. The answer is C. Tardive dyskinesia. The most likely cause of uncontrollable muscle movements in the absence of other systemic symptoms in a patient with a history of antipsychotic drug use is tardive dyskinesia. This is a disorder of rapid involuntary movements, most often in the face or head but also potentially affecting the extremities. Its exact cause is not well understood, but it is theorized to be an issue of sensitization of the D2 dopamine receptors after long-term neuroleptic use. Which of the following is not a common side effects in individuals using selective serotonin reuptake inhibitors, SSRIs? A. Increased risk of bone fracture. B. Low libido. C. Increased risk of suicide in children and adolescents. D. Coronary heart disease. The answer is D. Coronary heart disease. While SSRIs have been known to cause a variety of adverse effects, including diminished libido, increased risk of suicide in children and adolescents, restlessness, photosensitivity, and increased risk of bone fracture, individuals taking SSRIs are not associated with any increased incidence of coronary heart disease. Which of the following over-the-counter medications has been associated with hepatotoxicity and liver failure? A. Cetirizine. B. Diphenhydramine. C. Acetaminophen. D. Acetylsalicylic acid. The answer is C. Acetaminophen. Acetaminophen has surpassed viral hepatitis as the most common cause of acute hepatic failure in the United States. Hepatotoxicity can occur in doses of 7.5 grams or up for adults and 150 milligrams per kg of body weight in children aged 1 to 6. None of the other drugs listed are particularly hepatotoxic. What is the mechanism of cytotoxicity in acetaminophen-related liver failure? A. Depletion of gliadothin. B. Blockage of bile canaliculi. C. Fibrosis of hepatocytes. D. Formation of fatty infiltrates. The answer is D. Depletion of glutathione. Acetaminophen depletes glutathione, one of the body's most important antioxidants. The liver is the body's main processing organ for environmental and ingested toxins, and glutathione is the primary molecule the liver uses to rid itself of the harmful byproducts of the detoxification process. When glutathione is severely depleted, such as with acetaminophen overdose, hepatic cells can rapidly necrose, resulting in liver failure and even death. An individual taking which of the following medications must be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis? A. Alendronate. B. Finasteride. C. Paclitaxel. D. Phalodipine. The answer is A. Alendronate. Alendronate is a bisphosphonate drug used in the treatment of osteoporosis and osteogenesis imperfecta. An individual taking this medication should be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis. Other gastrointestinal adverse effects of alendronate include esophageal strictures, achalasia, gastric ulcers, and gastritis. None of the other medications listed are associated with esophagitis. Which of the following is not a side effect associated with beta blockers? A. Dizziness. B. Fatigue. C. Weakness. D. All of these are side effects of beta blockers. The answer is D. All of these are side effects of beta blockers. The most common side effects of beta blockers are fatigue, dizziness, weakness, cold hands or feet, dry mouth, headache, nausea, diarrhea, and shortness of breath.